first thing to consider would be is if you've had exposure. So, if you're one of those people that you're really good staying home, not going out and about, definitely less likely to get it. We know that there's a lot of hot spots out right now, and Manitowoc is definitely, unfortunately, leading the country in COVID cases. But, it can be kind of hard, I think, sometimes to know what to do because there's so much information out there. And so I would recommend, I guess, first, if you have questions, if you should get tested, there's a couple of things. One, you can always call your primary care provider and say, these are my symptoms, these are my concerns. Can you help me figure out what I should do next? Advocate Aurora has on their website a symptom checker. That's also another great place to go, that you can kind of click through what your symptoms are and help you decide what you should do next. And the CDC website has something very similar to what Aurora has as well. So those are great places that you can go. If you've had exposure, and then you probably should get tested. But again, that there's a lot of issues right now with limited testing supply, and the supply goes up and it goes down. So I think contacting your provider, going through the symptom checker is probably a really good place to start. I know we're all pretty sick of staying at home, but it really is a really good thing to do. Limit your contact with groups, large groups. When you do go out, wear masks. And I know masks can be a bit of controversy because of some, maybe unscientific evidence or stories that spread, but we do know that masks do help prevent the spread, and they also will help to decrease the symptoms that if you do get sick. Social distancing, 6 feet. So we know that COVID spreads through the air from an infected person. So if you're wearing a mask and keeping your distance, those are all really important things to do. And then wash your hands. When you get out of a store, put some hand sanitizer on after you're touching things, sanitize, wash your hands for 20 seconds with soap and water if that's available. If not, the hand sanitizer, but definitely limiting large groups and going out unnecessarily. Gloves is not part of the CDC recommendations in general for preventing the spread of COVID. Whatever is on your hands would be on your gloves. And so when it would be good to wear gloves are, one, maybe you're caring for somebody with COVID and you're having to interact with them, you'd want to wear gloves then take them off and sanitize, cleaning products and things like that. But in general, my personal observations are that when I see people out and about wearing gloves, they might even be putting themselves a little bit more at risk because they seem to have some thoughts that there's a level of protection. It really is not touching your face. So whether you're wearing gloves or not wearing gloves, don't touch your face. Don't pull your mask on and off, by face, eyes, nose, and mouth, because those are all ways that the COVID can get in. So go out, don't touch your face, sanitize, wash your hands. That generally is enough. Most cases, gloves would not be necessary. One option is through the Advocate Aurora website with the symptom checker that you can go on. And at that point, the options are, if you were exposed and not having symptoms, we have community testing. These drive-through testing stations that you can go and get the community testing, and that has to be scheduled through the website. If you contact your primary provider, they can advise you as well, what maybe would be the best place for you to go for testing. If you have symptoms of COVID that you think, I need to be evaluated, I'm not feeling well, I need to be seen, then you could come to the urgent care and you could be seen, and then the provider then could decide if you need to get tested and what would be the appropriate route with that. If you were having significant shortness of breath, persistent chest pain, difficulty breathing, confusion, or if somebody's commenting that, maybe a little blue around your lips or your fingertips, then you would definitely want to call 911 and go to the ER for the higher level of care.